psoriasis is actually a common illness right now, because I've come across like two, not three, not even four, a lot of people who is suffering from psoriasis, and they are unaware of the skin issue. So now, what is psoriasis? Psoriasis is a chronic reoccurring autoimmune disease, okay? Because it occurs when there is an overactive autoimmune system attack. Okay, when the immune system on its own is autoimmune, is on its own, it works like nobody knows the causative agent, nobody knows what actually is making it, like why is it occurring, something like that's why it's autoimmune. So it can lead to build up of, rapid build up, and form a raised red patches. Most times is in red patches. So the red patch, I'm going to look for the picture. Maybe in my next video I'll just put the red patches. So sometimes it can differ in different individual. Actually, it can differ in different individual. So it's actually not curable, but it can be managed by topical medication, maybe by antihistamine, depending. So some people, when it's severe, you can even opt for light therapy. Light therapy like LED therapy, then maybe using the red light, the blue light, the green about the cirrhosis. So the cirrhosis actually affects the healthy skin cells. It affects the healthy skin cells, and when there is overactive, when there is overact, when the cells overact, when they overact upon each other, that's where the cirrhosis actually comes from. I don't know how to explain it, but it's actually an autoimmune disease. So how do you know that you have cirrhosis? First of all, you will see some patches. Like I said, the red patches. Most time it comes at the red patches. Sometimes it comes at maybe slightly pink patch. So it comes with itchiness and soreness. Itchiness and soreness. That area will be maybe itching you intensively, and it's actually very painful. So the location are usually your elbow, your knee, your scalp. There is also lower back. In fact, it can develop anywhere around your body. So for people that cirrhosis affects their nails, it affects the fingernails, it affects the toenails too. So there will also be change of color depending on the severity. So at times, some people can even come down with arthritis, cirrhotic arthritis. But these ones affect the fewer generation of people. So like I said before, what are the causes? So we talk about the causes can be autoimmune. It can occur on its own. It can be triggered by the environment. It can be genetic. So there is no exact cause for that cirrhosis. So it's just a combination of too many factors and triggers. Sometimes it can also be triggered by stress. It can be triggered by, maybe if you have a bacterial or viral infection, it can be triggered by it. It can even be triggered by normal skin injuries, or if you're on any medication, cirrhosis can be triggered by certain medication. So now let's talk about the treatment. So like I said, the treatment can be orally, the treatment can be topically. Orally, in the sense that we have systemic medication. When it's severe, so we can say that we can place you on antihistamine, we can place you on immune booster. Okay. So, and again, when we are giving you topical treatment, So you can look out for creams or ointments that will help to reduce the inflammation, that will help to reduce the itchiness topically and the pain. Okay, it can be a cocktail of topical ingredients. So for people whose cirrhosis are triggered by medication, so by getting your past medical histories, we can you streamline you to taking you off the medication that is triggering the cirrhosis, and placing you on antihistamine and the topical treatment. So for people whose own are being triggered by stress, so the stress will not be managed depending on your location and what you are doing. Okay, so this topic is actually a broad topic, and maybe I'm going to do a pictorial presentation of what cirrhosis can be like, in case if you are confused on the pictures, how it's like on the skin, on how it's like on the color of your skin, because the whites, it appears differently on white skin, it appears differently on black skin. So I'm going to make the next video and get a pictorial diagram of how it looks like. Alright, so if you have any question, you can drop it. I will be able to answer you, and let me know what you think. Do you have cirrhosis, or do you have anybody that has cirrhosis? Let me know. Bye.